This episode of Healthwise needs no introduction. We have once again the prominent and most informative OB/GYN here in Cebu, Dr. Mila Chan, and our topic will be as revealing as all the others, sex after 50 and beyond. We often assume that people at that age are not sexually active anymore, and people, especially women at that age, believe that they should not feel sexual anymore, and they are often ashamed to discuss sex with anyone, not even their doctor. Well, this show is dedicated to those women out there and for everyone who want to be enlightened. Watch the show and know more from our guests, especially our surprise guest from Oh No, It's Johnny, none other than Johnny Litton himself.
Hello, Dr. Mila. Welcome
Hi.
again to the show.
Here we are again, Mayan.
And then,
DJ.
my partner here, DJ.
Hello.
Second time we're together.
Yes.
And
Yeah, this is the second time.
we already have discussed about premarital sex, safe sex, and then how often do you have sex? But we have never discussed or even looked into sex after 50 for women, right?
Okay.
So maybe that's
I'm willing to admit I'm after 50.
so maybe that's the topic that we must tackle
Address.
now.
Okay. I'm game.
And do you have patients beyond 50 who are very much interested in this subject?
Of
And
course.
it's nothing.
It's not abnormal.
unusual?
No, it's not abnormal. You could always look at Elizabeth Taylor and her 8th husband,
But
Senator
she's
Warner.
not
but she's
the
showbiz,
usual.
so she's different. But the problem, or if you're willing to talk about it with your patients, they'll talk about it with you. Nobody is willing to open it up or admit they're having sex, and you might get shocked. For instance, I had this one patient that I was going to do vaginal hysterectomy on. So I was telling my resident, when you're going to do a repair, you would like to make it as tight as you can so it doesn't recur. On the other hand, you have to find out if she needs it to remain functional in terms of sex.
Why?
So,
Why? Otherwise, you won't do the repair anymore.
well, you will do it, but you can adjust to the needs. So I tell my resident, okay, you have to ask your patient if she's still sexually active. And then she looked at me and said, oh, come on, doc, you think they still do it at that age?
How old is she?
She's like 76.
Oh,
Then
yeah,
I said,
true.
if you don't ask, you don't know. And you have to ask in such a way that you're sensitive enough that the patient will not get embarrassed. So she said, how do you ask, doc? I said, well, you don't ask, nag-sex ka pa ba? The way you are saying, nag-sex pa ka, You don't say it that way. You say, does it hurt when you have sex? Then that means you are
Presupposing.
accepting that she's supposed to be having sex. And if you don't ask, you don't get an answer. And when I deal with patients of this age group, sometimes they're saying headache, stomach ache, nervousness, inability to sleep. And sometimes you're surprised when you say, how's your sex life? They won't open it up, and then they begin to cry.
So for women above 50 or above 60, they really have a sex life.
Oh, DJ. Of course they do.
Because I think the common misconception that we have is as couples grow older, they evolve into just companionship,
Friends.
just friends, and the passion is not there anymore. So it's true
Brother
that
and sister na lang.
Brother and sister.
Well, actually, it's a question of having an interested and able sexual partner. Because women usually have sex in the context of love, right?
True.
It's not just a biological function.
True.
So if you are in love with the person you're with and he's still able to have sex, of course you will be able to have sex. It's very passive in terms of a woman.
With us women, because we love our men, it doesn't really matter with us. It really doesn't matter.
So I said,
So in terms of,
So- but the
desire is there.
Yes,
well,
for
depends on your
for
interested
women,
and able sexual partner.
yeah, for women, yes.
Yes.
It's just
Yeah.
that we suppress it and we
Yes.
don't
You
think
don't go
about
out
it.
looking for it.
Yeah.
So at what particular time does it decline or it never declines?
Well, after the menopause, there is some degree of decline, but in some women it increases because actually, the sexual drive is related to testosterone. And when women reach the menopause, the pituitary gland tells your ovary, hey, wake up, make some more hormone. But there's supposed to be a feedback mechanism where the estrogen produced by the ovary is supposed to go back and say, okay, I got the message. Now, when you reach the menopause, there's no more feedback. The estrogen is not there anymore, it's gone. So the one that's coming out is testosterone. So many women after the menopause become more sexually arousable. The fear of pregnancy is gone.
Yes.
And
Exactly.
the testosterone level is higher in the women. So the presence of an able and interested sexual partner is the one that's paramount. Of course, if you never liked it before, you're not gonna like it anymore after the menopause. But if it was something that you enjoyed together before the menopause, there's no reason why it will stop. It may become actually more
Pronounced.
arousable after the menopause.
More fun.
More fun, yes.
But is there no, I just have to ask this, discomfort?
There is some degree of dryness, but then your friendly neighborhood doctor can give you, there are vaginal estrogens in lubricants, and a little bit more patience on the part of the partner. And again, we're going to an interested and caring partner who will take the time and the patience.
And is
to do
this
these
something
things.
that they can buy over the counter?
In the Philippines, you can buy anything over the counter except morphine.
Yes, I guess, yes.
Yeah.
You can buy. You
Yes.
can buy. You can buy.
And the neighborhood dispatchadora who is in the pharmacy will even be the one to tell you, oh, kini, this is nice. Oh.
This brand is better than the other one.
Which they're not supposed to do, but
Yeah.
unfortunately, I have a pharmacist granddaughter, so she's gonna get upset when he said, "You can buy anything over the counter because you can. You're not supposed to, but that's
And
business."
women are not embarrassed to do that, especially if they're already on the advanced age. Or they ask somebody to do that for them.
Well, if you buy lubricant, it can be lubricant for anything.
Yeah,
For
so lubricant
Oh,
for
I mean,
anything.
it can be for whatever purpose,
Yeah.
not necessarily for that. So I guess it's nothing to be.
It doesn't
embarrassed
have to be medical lubricant.
about. Yeah,
There's so many things that you can use.
true.
Petroleum jelly, baby oil, strawberry jam, whatever.
for as long as it does its purpose.
All you
See,
need is-
you're learning.
Yes,
You're learning.
That's something that's new to me.
Exactly. It doesn't have to be.
It makes it more interesting because you'll go into there. It's not just regular sex. There are so many things that can be done. Because as I said, interested and able. When you're a 60-year-old woman with a 60-year-old partner, many times they're diabetic, they're hypertensive. Many of the drugs that they use in hypertension will make them lose the ability to have performance. So you should ask about these things. Even things like things that you use for your colds to unclog your nose. They make everything constrict. And in order to have lubrication and, I don't know if I'm supposed to say, erection, it has to be vasodilatation. The blood vessels have to engorge. And if you're taking these things that make your blood vessels very small, it can interfere. So you have to go into that history. Are you taking any medications? Because
Okay.
sometimes that's all.
But how about for women? Do they also are they also affected with the medications
Of course.
that they go through? And that
Of course.
also affects their
It's
drive.
basically the same process.
Same
That's
basic
why
process.
that's why you go back. You asked it earlier before we started about sildenafil called Viagra. It's an off-the-counter, off-approval use that women can actually use Viagra also. Because
it
it
can also
improves
be-
vasodilatation, so when you have vasodilatation, it improves lubrication.
So it can also be used by women?
Oh, yes.
But how come, Doc, that it's not yet approved as of this
Because
time?
you have to be using, these are drugs that are not essential to save lives.
Okay.
So that the FDA regulations are more stringent in trying to prove not just effectivity but safety.
Yeah, because they say
Oh, yes.
it has side effects. I mean, it could
In-
cause
In terms
heart-
of cardiovascular,
heart- yeah,
because it
heart,
was originally a cardiovascular drug, thinking that if it will dilate the blood vessels of the heart, it will stop a heart attack. But then they discovered the opposite effect on the heart.
It can cause.
It can actually constrict the heart.
Which reminds me of another possible myth, because I've also heard that because women or men or couples on advanced age, the reason why people have the impression that they don't have sex anymore. It's because of the risk of having heart attack. Is it true or false?
The fear.
The
that if
fear.
you-
Well, there was
in
a
the-
series on that. I'm sure that was very popular. That even after a bypass operation, they're allowed to have sex, but the doctor says only something a little bit boring, just with your wife.
Okay, so you see,
You see?
our discussion is becoming more interesting. So more about this when we come back.